Men over 40 who ejaculate less than 21 times per month have a 33% higher risk of developing prostate cancer, according to Harvard Medical School research. And most guys have no idea this connection even exists. If you've noticed changes in your sexual activity as you've gotten older, you're not alone, and it's completely understandable to wonder what's normal. What many men don't realize is that there's important health information connected to these changes that your doctor may not have discussed with you. I'm Dr. Rachel, a urologist with 13 years of experience focusing on men's vital health at every stage of life. Today, we're going to walk through what medical research actually tells us about ejaculation frequency and men's health, how to recognize whether what you're experiencing is typical aging or something worth bringing up with your doctor, and practical steps that can help protect your long-term health. We'll also talk about when it makes sense to seek medical guidance, and which specific lifestyle adjustments have shown real benefits for maintaining sexual function as you age.
Part 1, what the Harvard research actually shows, the 21 times per month number. If you're hearing this number for the first time and feeling surprised or perhaps a bit anxious, that's a very common reaction, and it's why we need to look at what the research actually shows. This finding comes from a large-scale Harvard Medical School project called the Health Professionals Follow-Up Study, and it's worth understanding because the connection is stronger than most people realize. Researchers followed 29,342 men over the course of 18 years, tracking their health outcomes carefully. When they looked at men who ejaculated 4 to 7 times a month compared to those who reached 21 times or more, a meaningful pattern emerged. The group with higher frequency had roughly a 33% lower chance of developing prostate cancer, depending on their age and the stage of cancer when detected. Looking at it from the other direction gives us that opening statistic. Men who stay under the 21 per month mark showed about a 1/3 higher risk. And this is information most men simply haven't heard. Many doctors encounter men who learn this number and immediately feel inadequate or alarmed. The important thing to understand is that this is population-level data showing an association, not a guarantee or a prescription. It's information you can use, not a source of shame. How the study was done. The participants were asked to report their ejaculation frequency at 3 different life stages: young adulthood, ages 20-29, midlife, ages 40-49, the year before they filled out the questionnaire. The research team then carefully adjusted their analysis for factors like diet, smoking habits, family history of cancer, and other known risk factors. After tracking outcomes for nearly 2 decades, the ejaculation variable consistently appeared as a protective factor. This wasn't a small sample either. More than 3,000 of the men eventually developed prostate cancer, which gives the statistics considerable weight and reliability. Understanding how thoroughly this study was conducted can help you feel confident in its findings, rather than dismissive or overwhelmed by the numbers. Why frequency matters more after 40. When researchers examined the data more closely, they found the protective effect became more pronounced once men reached their 40s. In the 40-49 age range, ejaculating 21 or more times a month was associated with about a 22% lower cancer risk compared with the 4 to 7 group. One possible explanation is that by this stage of life, prostate cells have had decades of exposure to hormones, inflammation, and environmental factors that can increase cancer risk. Regular ejaculation may help clear out potentially harmful substances or reduce inflammatory buildup in the gland at a time when the tissue becomes more vulnerable. Think of it like running water through pipes regularly so mineral deposits don't build up. It's a simple mechanical process that becomes more important as the system ages. If you're in this age group and realizing you're below this frequency, please know this doesn't mean damage is already done. It means you now have actionable information to work with going forward. What other research says. The Harvard findings aren't standing alone. Other research teams have reported similar patterns. An Australian study of 2,338 men found that each additional 3 ejaculations per week during their 20s was linked to a 15% reduction in later prostate cancer risk. A European multi-center investigation reported a comparable trend, particularly for aggressive, faster-growing cancers. Even laboratory studies support this idea. When researchers limited sexual activity in rodents, markers of oxidative stress increased in prostate tissue. No single study tells the complete story. But when multiple research teams across different continents, using different approaches, all point toward the same conclusion, it's a finding that deserves serious attention. What this means in plain English, frequent ejaculation isn't a guaranteed shield against prostate cancer, but it does appear to be a relatively simple habit associated with better odds against a disease that concerns most men as they age. It's important to know that the method doesn't seem to matter, whether ejaculation happens through intercourse, masturbation, or nocturnal emissions. The prostate responds to the end result in the same way. Many men feel embarrassed discussing masturbation with their doctor, or feel that discussing frequency sounds crude. In clinical practice, this is straightforward physiology. There's no judgment attached, only information. While 21 times a month is the specific number from the research, what matters most is consistency. Reaching that frequency 1 month and then dropping to 4 the next won't give you the same benefit. Steady, regular activity appears to be what makes the difference. This information is meant to empower you, not to create pressure or anxiety. Understanding the connection puts you in a position to make informed choices about your health. With this context in mind, you're probably wondering, how can you tell whether the changes you've noticed in your own patterns are just part of normal aging, or whether they're signs of something that needs medical attention? Part 2. Normal aging versus warning signs. You shouldn't ignore expected changes. Most men notice after 40. One of the most common concerns I hear about is men noticing changes and immediately fearing something is seriously wrong. Let me walk you through what's typically part of normal aging, so you can approach these changes with clarity rather than fear. If you've observed that ejaculation feels less forceful than it used to, that's a common experience. The muscles responsible for ejaculation naturally lose some strength over time. Many men also notice that semen volume decreases somewhat as the prostate and seminal vesicles gradually slow their fluid production. The refractory period, meaning the time your body needs before you can achieve another erection, typically lengthens, sometimes shifting from minutes in your 20s to several hours, or even a full day after 50. Orgasms may feel somewhat less intense than they once did, and you might find you need more direct stimulation to reach climax than you did when you were younger. These changes usually happen gradually over a period of years, so they don't typically feel like a sudden drop-off. And that gradual pattern is actually reassuring. Recognizing that these experiences are shared by most men as they age can help reduce the isolation or worry you might be feeling about your own body. The slow decline of testosterone. Testosterone reaches its peak in the late teens and early 20s, then begins a slow decline of about 1% per year after age 30. By age 60, many men are running 20–30% below their peak levels, which can affect libido, energy, mood, and muscle mass. It's worth knowing that lower testosterone doesn't automatically mean poor sexual function, but it does make your body somewhat less efficient at producing nitric oxide, the chemical that helps dilate blood vessels during arousal. This is one reason why exercise, adequate sleep, and good nutrition become increasingly important. They help you make the most of the testosterone you still have. Practical observation: if you're not waking up with morning erections at least a few times a week, it's worth mentioning to your doctor. Morning erections serve as a useful home indicator of nighttime testosterone activity and blood flow. Understanding these hormonal shifts helps you see that what you're experiencing isn't failure. It's a natural biological transition that can be supported with the right approach. Red flags that need professional attention. While gradual change is normal, certain patterns do warrant medical evaluation, and recognizing these can help you seek help at the right time without unnecessary delay. Sudden onset erectile dysfunction. meaning you go from normal firmness to soft or absent erections within a matter of weeks or a couple of months, is not typical aging and warrants evaluation. Complete inability to ejaculate, which doctors call anejaculation, or a dramatic drop in semen volume almost overnight can point to a blockage, medication side effect, or nerve issue that needs assessment. Pain, burning sensation, or visible blood during or immediately after ejaculation often suggests infection, prostatitis, or in rare cases a tumor, none of which should be ignored. Consistent loss of interest in sex accompanied by fatigue, unexplained weight gain, or low mood might indicate clinically low testosterone or uncontrolled diabetes. Rather than simple aging, doctors commonly see men who've waited months or even years to bring up these concerns out of embarrassment. Please know that bringing these issues to medical attention early often leads to much simpler solutions. If any of these issues persist for more than 3 months, it's time for a medical evaluation rather than waiting to see if things improve on their own. Being able to distinguish between expected aging and true warning signs helps you advocate for yourself effectively and seek care when it truly matters. Why your sex life can predict your heart's future. Here's something many men don't realize, and it's one of the most important reasons to pay attention to sexual changes. The arteries that supply blood to the penis are only about 1 to 2 millimeters wide, much narrower than the ones leading to your heart. When plaque begins forming in your arteries, those smaller vessels tend to show symptoms first, which means erectile dysfunction can appear 3 to 5 years before you'd experience chest pain or a heart attack. Harvard researchers have found that men with new-onset erectile dysfunction have roughly double the risk of future cardiovascular problems, even after accounting for age and lifestyle factors. So if you notice your erections weakening rapidly or climax becoming more difficult, especially if you have risk factors like high blood pressure, abdominal weight gain, or a history of smoking, it's important to let your primary care physician know. Viewing changes in sexual function as an early warning system isn't overreacting. It's actually a form of proactive healthcare that can protect your heart health down the line. This connection means that what you might have dismissed as just an aging problem could actually be your body giving you valuable advance notice about your cardiovascular health. Understanding this connection naturally leads us to an important question. What can you actually do starting today to help maintain healthy function?
Part 3. Evidence-based steps to maintain sexual function. 1. Move your body. The 150-minute game plan. If there's one change that consistently makes a difference, and this comes up again and again in clinical discussions, it's establishing a regular exercise routine, even a modest one. The foundation of maintaining sexual health as you age starts with regular physical activity. Both the American Heart Association and numerous urology studies point to the same recommendation: 150 minutes of moderate aerobic activity each week. If you break that down, it comes to about 30 minutes a day, 5 days a week, a manageable goal for most people. Brisk walking, cycling, swimming, or even mowing the lawn at a steady pace all qualify. Why does this matter for sexual function? Aerobic exercise helps keep your blood vessels flexible and clear, supporting the circulation that healthy erections depend on. One comprehensive review found that men who maintained this level of activity reduced their risk of erectile dysfunction by roughly 40%, a significant benefit. It's also helpful to add 2 days of full-body strength training each week. Push-ups, dumbbells, resistance bands, whatever equipment you have access to works fine. Lifting weights creates a temporary spike in testosterone and helps maintain the muscle mass that supports healthy hormone production over time. Aim for 8 to 10 different movements that work your major muscle groups. 2 or 3 sets of 8 to 12 repetitions is sufficient. What matters most is consistency rather than intensity. You don't need to lift extremely heavy weights to see real benefits. The encouraging part about exercise is that benefits often appear within weeks, not months, giving you fairly quick feedback that your efforts are working. 2. Train the muscles you can't see. Pelvic floor work. Kegel exercises aren't just for women after childbirth. They're actually a valuable tool for male sexual health that many men don't know about. Your pelvic floor muscles contract with every ejaculation, so keeping them strong translates to better force and control. Here's a straightforward routine you can start today. Contract the muscles you'd use if you were trying to stop your urine flow midstream. Hold that contraction for 5 to 10 seconds. Release and relax for the same amount of time. Do 10 to 20 of these contractions once or twice daily. It takes about as long as brushing your teeth. After 4 to 6 weeks, most men notice stronger orgasms and fewer accidental urine leaks when they laugh or lift something heavy. One caution: don't overdo these exercises. Fatiguing your pelvic floor muscles can actually create problems rather than solving them. These exercises cost nothing, require no equipment, and can be done anywhere, making them one of the most accessible interventions available to you. 3. Eat like your prostate depends on it. Research continues to point toward the Mediterranean dietary pattern for good reason. It's one of the most consistently beneficial eating styles for sexual health. Fruits, colorful vegetables, whole grains, legumes, nuts, olive oil, and regular fish consumption create a nutrient combination that protects blood vessels and helps balance hormones. Men who follow this pattern closely tend to score higher on erectile function assessments and show lower rates of metabolic diseases, the same conditions that can significantly impact testosterone. Here's a practical way to build your plate. Fill half with vegetables and fruit. Think spinach, tomatoes, berries, and other colorful options. Use a quarter for lean protein. Salmon, sardines, skinless poultry, or beans all work well. Reserve a quarter for whole grains, quinoa, brown rice, or whole wheat pasta. Season with olive oil, herbs, garlic, and add a small handful of unsalted nuts for texture and healthy fats. It's also important to limit processed meats, fried foods, and sugary beverages. These tend to promote inflammation in arteries and spike insulin, both of which work against sexual health. Dietary changes don't require perfection. Even moving closer to this pattern, even 60 to 70% of the time, shows measurable benefits in research studies. 4. Micronutrient boosters and simple daily habits. Even a well-planned diet can sometimes miss certain key nutrients your body needs. Zinc deserves special attention because your prostate stores more zinc than any other tissue in your body. You can get adequate zinc from 6 raw oysters, which covers your daily requirement in a single serving, a palmful of pumpkin seeds, or a small bowl of chickpeas. Vitamin D also plays an important hormone support role. 15 minutes of midday sun exposure or a doctor-recommended supplement helps keep your levels in a healthy range. Hydration is one of the simplest wins. Drinking 2 to 3 liters of water daily helps maintain optimal blood volume and supports semen production. If you smoke or drink heavily, cutting back makes a real difference. Both nicotine and excess alcohol constrict blood vessels and lower testosterone. Finally, getting 7 to 9 hours of sleep each night completes the picture by allowing your body's nighttime testosterone production and reducing the stress hormones that interfere with libido. These small, daily habits add up, and the beauty of this approach is that each element supports the others, creating a compound effect rather than isolated benefits. With these lifestyle foundations in place, you have practical, evidence-based tools to support your sexual health without necessarily needing medication. Of course, there are times when self-care isn't enough, so let's talk about recognizing when to seek professional help and what doctors can offer when changes become more severe or happen suddenly.
Part 4. When and how to get medical help. Get tested, know your numbers. If you've been hesitating to bring these concerns to your doctor, please know that this is one of the most common reasons men delay care, and also one of the most unnecessary sources of prolonged worry. Seeking medical help typically starts with a straightforward blood test. Ask your doctor for a total testosterone test done before 10 a.m. Since testosterone levels are highest in the morning, if two separate morning tests come back below about 300 ngdl and you're experiencing symptoms like low sex drive, persistent fatigue, or muscle loss, that's generally considered clinically low. It's important to understand that numbers alone don't tell the complete story. Some men at 280 ngdl feel perfectly fine and may not need treatment, while others at 350 ngdl with significant symptoms might benefit from intervention. When you get your lab report, take time to review the reference range and pay attention to both total and free testosterone. Free testosterone is the portion your body can actually use for its functions. Having concrete numbers gives you and your doctor a clear starting point for discussion. Rather than vague concerns, this clarity often reduces anxiety significantly. The visit, what your doctor is looking for. A thorough physician will work to distinguish between slow, decades-long changes and more sudden drops in function. Gradual changes, like slightly softer erections or longer recovery times, typically point toward normal aging. Abrupt erectile dysfunction, sudden loss of ejaculation ability, or new pain can be early indicators of diabetes, hypertension, or arterial blockages that haven't yet shown up in other ways. You'll likely be asked about current medications, alcohol use, sleep quality, and stress levels, since each of these can significantly affect sexual function. Expect a physical examination that includes blood pressure measurement, waist circumference, a testicular check, and often a brief prostate assessment. Doctors are trained to discuss these matters matter-of-factly and without judgment. Your honest answers help ensure you receive the most appropriate care. Treatment toolbox, from pills to hormones. The first-line medication approach often involves a PDE5 inhibitor like sildenafil, commonly known as Viagra. Taken about an hour before sexual activity, it enhances blood flow and tends to work best when combined with the lifestyle habits we discussed earlier. If testing confirms that low testosterone is the primary issue, your doctor may discuss testosterone replacement therapy as an option. TRT can be administered through weekly injections, daily gel applications, or longer-acting pellets, always under medical supervision with follow-up lab work every 3 to 6 months to monitor prostate markers, red blood cell counts, and cardiovascular indicators. When both low testosterone and blood vessel issues are present, combining TRT with a PDE5 inhibitor often restores both desire and performance more effectively than either treatment alone. These treatments are well studied, generally safe when properly monitored, and have helped countless men restore quality of life. There's no reason to suffer in silence when effective options exist. Talk like a pro. Questions to bring. Having specific questions prepared can help you get the most from your doctor visit. Do my symptoms seem more consistent with normal aging, or might they indicate an underlying condition? Could any medications I'm currently taking, like beta blockers or antidepressants, be contributing to these changes? What are my fasting glucose, cholesterol, and blood pressure numbers? And how might they be connected to what I am experiencing sexually? If we decide to try TRT, which specific targets and safety markers will you be monitoring? How long would you recommend trying lifestyle modifications before we consider adding medication? And how will we measure whether things are improving? With these tools and this understanding, you can approach your doctor visit feeling prepared, informed, and ready to take an active role in protecting both your sexual health and your overall well-being. To bring everything together, maintaining consistent ejaculation appears to support prostate health. Recognizing the difference between normal changes and concerning symptoms keeps you ahead of potential problems. Practical lifestyle habits help preserve function, and timely medical guidance fills in the gaps when self-care isn't enough. If you found this information helpful, please hit the like button, share your own experiences or questions in the comments below, and subscribe for more evidence-based content on men's health. What's the one change you're planning to make this week to help protect your sexual health for the years ahead?